Hello guys, today we're going to be talking about hemorrhoids. Hemorrhoids are swollen blood vessels, the veins in the lower rectum and the anus. The lower rectum is the lowest part of the large intestine. About 75% of adults will have it in their lifetime. Good news though, effective cures exist. So what are the symptoms? They include swelling, bleeding, severe pain, irritation, problems with passing stool, depending on the kind of hemorrhoids the person has. There could also be itching around the anal region, that is around the anus. Hemorrhoids can get complicated in that there may be inflammation, infection, that is from hemorrhoids that have burst open and been exposed for too long. So what are the common causes? Eating low fiber diet, your polished meals, your meat pies, your shawarmas, and the rest of them. Exercise, straining exercise, that is excessive heavy lifting, sitting on the toilet for too long, obesity, being overweight, pregnancy, having intercourse, training while on the toilet, sitting for long periods on the toilet, or sitting in the wrong position on the toilet, long or chronic diarrhea or constipation can also cause it. Remember, these are the things that cause stress on the rectum and the anus and cause the blood vessels to become slack and swollen. Because of these causes, can be some complications. Person may have low blood levels, that is anemia, blood clots in those veins because the blood cannot move back to the heart. The hemorrhoid can be strangulated, that is trapped. That can cause severe pain and may also lead to infections. Because we know the causes, prevention is easy. Avoid sitting on the toilet for long periods of time. Don't stress yourself or strain yourself when you're passing stool. How do you do that? By making sure that you eat a high fiber diet so your stool is bulky and not hard. Do routine exercise. Make sure you go to the toilet immediately you feel the urge. Don't wait and say, oh, it's not convenient now, I'll wait later. That can increase stress and also weaken the muscles and the blood vessels. For those people that say, oh, they can't get fibers, there are tablets, that fiber tablets that can also help. Dietary supplement can also help softening your stool and help you pass stool properly. Remember, the key point here is straining. So anything you can do to reduce the straining and amount of stress you have there. You should also know that sitting position on a conventional toilet can make it higher for the risk to have hemorrhoids. This picture shows you the proper sitting position. Get a stool if you need to. That position loosens the muscle that keeps the intestine trapped, so less strain is required. Remember, sitting for less period also helps. So how do we make a diagnosis? The doctor wants to examine the person, meant to do a digital examination, that is use the finger to examine. Look for hemorrhoids that are internal or external. In cases where the hemorrhoid may be too soft for the doctor to feel, he may need to visualize, use a proctoscope or a digital camera to view the inside of the intestine. Remember that hemorrhoids are not the only cause of bleeding and obstruction and difficulty in passing stool. There may be cancer, there may be other issues. So visualizing it will also help finding out the exact diagnosis. But when the doctor uses this, takes history, asks about your stool experience, asks about your meal, asks about your diet, asks about your exercise routine, your daily routine, you will be able to narrow it down and say, oh yeah, this thing that you have, this bleeding you have is a result of hemorrhoids. Then treatment can be given. One of the treatment options is removing that part of the vein that is swollen, because there's a network of veins. There's no long-term damage to removing that vein. Sometimes we have to open the vein that is blocked, that has blood clot, and bring it out the clot, and that may be the end of it. We should also note that hemorrhoids recur. That is, if you don't stick with the routine and the counsel and what we've talked about, it may come back again even after effective treatment. So what are the home remedies that we can use? Because I know a lot of people are concerned about what can I do at home without going to the clinic. You can take your regular pain relief tablets. You can sit in warm baths, salt water, sit bath as we call it, for long periods. This will help shrink the swollen blood vessels, that is the veins. Eat a lot of fiber. You can't overemphasize that, or take fiber supplements. Soothing creams, balms, and gels that you can apply to help with the swelling, the inflammation, the pain. And I hope with this little point I've been able to expand about hemorrhoids. Thank you for listening and watching. I'll see you on the next one. Bye-bye.